I really want to have the questions up though. Number one second, I got them here. Number one should be B. Okay, when they're asking about the axillary view, it's an X-ray of the shoulder. Make sure you have that. Number two would be D as in David. D as in David. And number three, these are all body planes, so these shouldn't be difficult if you were able to look them up. Number three would be A as in apple. Number three, A as in apple. And number four, AP and lateral chest x-rays were performed for a cough. What's the CPT and ICD-10 code? Number four would be B as in boy. B as in boy. And number five is D as in David. And I'm going to open the line. If everyone can make sure that they mute their screen, mute their phone so we don't get any background noise. Okay, and what we're looking at, there's nothing on the screen right now unless you guys want to, we can see the test together. I can do that. But you should have the test in front of you right now. All right, so we're on number 5 is D for the mammography, the screening. Number 6 in your homework is B as in boy. Remember, the patient's coming in for a colonography. So as far as you looking it up in the CPT, you would look for colonography because that is your term. Remember, that's the actual procedure. And then what else are they coming in for? They're basically coming in for a screening. Okay, so you can go colonography, and then it also said they were doing a CT. So you can go CT and then look for screening. Okay, does anyone have any questions on that? Because for sure, let me just open the lines for a second. I am going to let you know, number 5, where they have questions on the mammogram, you're definitely going to see those. You're going to see a question like that on the exam. So you have to make sure if you have questions, remember this is the time to ask questions. I know we have a bit to cover tonight, but I want to make sure that you're understanding as we go along.
I'm speaking, Janine.
Okay.
I missed, this is Andrina.
Okay.
I actually selected C, so I got it wrong.
You selected C.
Yes.
Did you leave off the computer-aided detection?
Yeah, I want to say I did.
Right. So remember, anytime you see CAD in the question, that is going to require those 2 codes. That's the key. That's the key in the question to let you know, hey, it's going to be something else in addition to the mammogram.
Okay.
So you know they're having a mammogram, but once you see CAD in the question.
Okay.
Yeah, once you see that in the question, and what number was that again? 4? No.
That was number 5.
Number 5 right here. I'm just looking at the keywords in that question.
Jimmy, why are you looking at it? Can you hear me? This is Rochelle.
Yes, I can.
Okay. For number 5, I have B. So I'm going back through that to figure out why did I choose 77056 instead of 57.
Okay, and here's the key thing is one of them are diagnostic. It doesn't state diagnostic, but the other one you'll see is a screening on your two selections for that first CPT code, your 56 and your 57. If you look at the CPT definition of 56 and 57, I believe one of them says screening and the other one doesn't say anything. That's considered to be diagnostic. Let me just go to it with you.
And I remember we talking about it. You have it written there.
Okay, guys, I'm going to need you to mute your phone so we can eliminate the background noise so that I can hear. Okay, I'm sorry, Rochelle, go ahead.
What I was saying was when we went over this last week, I did wrote down diagnostic next to bilateral. I didn't highlight it, but I highlighted the bilateral for the 77056 and then the 77057, I highlighted the screening.
Right.
But that's where I went wrong was the diagnostic because I was trying to determine where did I go wrong with this particular code.
Yeah, so let's do this. How about next to 77055? You're gonna write diagnostic.
7055 and 7056.
Yes, because that's just illustrating one side or both sides. So they still fall under the same category, right? And then just even though you've highlighted screening on the outside of 77057, I would still write it out in my own words. I want you to feel comfortable. I want you to know as soon as you get there, that's the one you're going to choose. And the that add-on, yes, the CAD is going to be your two add-on codes. Those two codes listed on page 454. That's 77051 and then your 77052. So what that means is your 77051 is for your diagnostic. Sometimes they will call it a baseline, which I think you have that question coming up too. It was another one that I put in there.
So you're saying 77052, that's CAD as well, and you said baseline?
Yes, the 77052, that add-on code is your screening mammogram. Remember, just like you had your diagnostic mammogram and your screening mammogram in the 77055 and your 77057 is for the screening?
Yes.
Anytime, the other thing I want you to put out next to the 77051 and your 77052 is CAD.
Got it.
Because it does say computer aided detection, but it's written out, right? And usually on the question, they're just going to say CAD, and they need you to be able to associate what that is. So now if you're reading that question and you know that you're reading about a mammogram and you see the word CAD or computer aided detection, that is an indication or a signal to you that you need to use one of the add-on codes. Right? And so how do you know which one to use? We've already separated them by screening and diagnostic. So they'll be grouped together. Right?
And I just want to make sure I'm hearing this correct. I'm sorry, and I'll be through with it.
Sure.
77051 is diagnostic.
That is correct.
CAD. Okay.
Yes. Okay. That's why they have the other one right underneath it is the same thing, but they just say that's the screening. Okay. And it tells you too, when you look under 77052, right, it tells you to use it with 77057 because that too is also the screening mammogram. The computer aided detection is when they're going into for guidance to go into, try and look for the lesion within the breast. So they'll use some imaging guidance, which is the computer aided detection, but they're grouped together by diagnostic and then by screening. So what some people have done in previous classes, they'll even like put under on page 455 where you have your 77057, sometimes they'll write if CAD plus 77052. You know what I mean? So you know they're already grouped together. because when they administer the exam, that's what they're going to say. They're going to say computer-aided detection, or sometimes they'll just say CAD. And you know what those two codes are. It's just for you to distinguish whether it's diagnostic, meaning they're just going in to look, or they're going to do an actual screening procedure. So I don't want you to read too far into it. What I do want you to just pay attention to is, just those keywords, the CAD, so you know you need another code. I'm going to go to, we did number 6, right? Look at number 7. Same type of scenario. We're still on the breast. So if you look at this right now, same type of scenario, Rochelle and Andrina, look at number 7. It says 40-year-old female scheduled for a routine screening. Even though they're saying baseline, it's still a screening mammogram, right? Don't let the terms throw you off. The key word in there is screening. Okay. And then once you see screening in your head, you should already be saying that 77057. Do you see that? So you see that your answer for number 7 is going, but they didn't have in number 7 though, you don't see computer aided detection, or you don't see the acronym CAD. You see where I'm going with that? So with number 7, you wouldn't need both codes, right? Because it's just a routine screening mammogram. It doesn't have any mention about a computer aided detection, or you don't see that acronym CAD there. So that means you only need that one screening code. And so for number 7, the correct answer would be C, as in cat. Yes. So that makes sense. I need you guys to make sure you're understanding that, because I guarantee you're going to see something similar. So if anyone does not understand, speak up now. Okay. So we seem to be okay. All right, you just highlighted the key terms, right? And you guys know how to associate the difference between diagnostic. The key thing there is going to be the screening. And even you also had your I-10 code, there. And basically what you would be looking for, the keywords would just be breast and then a routine mammogram. And that would take you to I-10 Z12.31. Okay. All right, let's move on to number 8. Number 8. Number 8 is A as an apple. Number 8 is A as an apple. And again, we're going over the homework. A as an apple. That's the patient that arrives to the urgent care. Again, when we're coding for x-rays, you have to remember your steps. You had your steps written down, right? First, I'm like, what's the name of the procedure? We see x-ray here. Where's the location? The ankle, what type of view? And so those key terms, you should be able to pull out those terms. Radiology shouldn't be difficult. The only thing you're looking for, it says x-rays of the ankle are taken to determine the patient has a fractured ankle. Right, so for number 8,
it's A.
It should be A, because if anybody picked anything else, I'd be like, where did you get the other information? Like if you had picked D, I'm like, why would you have ×2? Where does it say anything about ×2? Okay, because the view is already mentioned in the CPT description, right? So we don't need to add anything else. Okay, number 9.
B.
Yes, number 9 is B. Someone asked for the answer for number 6. Number 6 is B also. Number 9 is B as in boy. Number 9 is B as in boy. Right, same thing. You're going to go under x-ray once you know what type of procedure, and then you're going to look for the name of the bone, which it was the fibula.
Fibula. Mm-hmm.
Yep, you look for the name of the bone, or you can use tibia, because I think they're grouped together. Fibula.
They are.
Yeah. Mm-hmm. And so, yeah, either one, you should lead you to I believe it's 73590.
Yes.
Okay. And the most important thing for number 9, you're going to add, well, there's 26 on all of them, but that would have been something you're looking for, right? Because these, where did he go? Keyword, I always want to know where they went. They went to the hospital. Anytime you see that it's an outside facility in radiology, then that provider CPT code should have a modifier 26 behind it. So for number 9, the correct answer is B as in boy. Number 10, that's talking about the DEXA studies. This is another one that you may see again. So let's hope you got it right. And let me tell you, for bone density studies, because that's basically what a DEXA scan is, it could take a long time to do those particular procedures. You can go straight to the index and go to bone density study. But you needed to know that that's what the DEXA scan stood for. It's a bone density study. So you can go to the index, you can look under bone density study, and then it's going to, and then you can be further divided by the axial skeleton. Let's see, of the hips. So that's part of the axial skeleton. And then you're directed, it'll give you code ranges. Okay, so you should have 77080. Number 10 should be C as in cat. And those were not close, so that one of them should have been a clear definition for you, because they were all different. I'm talking test taking strategies now, so we got to remember, if they all look different, you got to know the answers there. Yeah. Number 11. Number 11, yes. Number 11 is A as in apple. Perfect. We're looking for the procedure. It's an MRI. Where's my location? It's the brain. So MRIs are basically diagnostic studies, okay? Or you can go to the index and look for MRI or magnetic resonance imaging. Again, you need to know what the acronym stands for. And then once you find MRI in the index, then you can just look for the brain. Right? And so for number 11, the correct answer is A as in apple.
I missed that one.
A as in apple. Remember, when you're looking it up, index, you go to the index, or you can look under MRIs in the reference page, and it's diagnostic and then brain.
Can I ask you a quick question? What would be the difference? I selected C,
Okay.
70551.
Yeah, let's go in there. Let me get there. $70551. Okay.
That's what I had.
All right, so you chose, let me see. Let's see, MRI, imaging, brain. And this is also going to be including the stem. And let me see, the question is saying functional MRI of the brain and rest while performing the task. And then I said 11 is A 70554. Because the keyword was that functional. You see where it says functional MRI in 70554?
Yes, I do.
Yeah, and then that category, highlight that.
Okay.
That's what threw you off right there, is the wording.
Genevieve, this is Rochelle.
Yes.
Also for Andrea, what caught my attention right above the 70554, that paragraph where it says functional MRI, I read it, and then I highlighted when neurofunctional tests are administered by a technologist. A technologist actually did this. That was a key word there. Or other non-physician or non-psychologist use 70554.
That's
so that was
yeah.
That
That's good.
helped me as well as far as the keyword and what I was when I highlighted in number 11.
That's perfect. So yeah, the non-physician uses 70554, and 555 would be if it was a physician, right? So
Correct.
yep,
Yes.
yep. But that paragraph, like you just stated, there are the keywords. I would say the keyword in there is administered by a technologist, and also
Yeah,
that functional,
yeah, and that's
neurofunctional
what I
test.
highlighted. Administered by a technologist, but I highlighted and underlined. And then the administered by a physician or a psychologist,
You
and
guys,
would when to use the code.
all right, that's perfect. Thank you for sharing. And that's what I want. I want us to kind of say what our tips are, because I may give you one way and someone may say, hey, this is what grabbed me. So I do want people to get involved because we're almost at the end. Almost at the end. Number 12. All right, let's see what's going on with number 12. So again, these should become routine. This is a pretty easy one, right? Radiology exam means that they had an x-ray once you see radiology, and then you're just going to look for the body part. Let's see.
I
Oh,
hope it's C. It was tricky. It was very tricky.
okay, they had a radiology exam from the nose to the rectum. That's a serious exam there. The
Right.
foreign body is not located, right? So they didn't find it, right? But they did. I do believe if you go to X-ray in the index, there's actually an entry from nose to rectum. So remember, I said you can go to the index, right? You can look up X-ray because that's a procedure. X-ray of what? Nose to rectum, and what are they doing? They're removing a foreign body. So your answer for number 12 should be 76010, which is A as in apple. But let's see what else. Yeah.
A?
No, what did you say, Genevieve? You said,
For
I
number
thought it's
12,
C.
I'm sorry, guys. C. C is in cat.
oh, okay. I'm about to say, I got it
I know you're, no, wait a minute. You would have been like, where are all the other procedures coming from?
wrong.
Right. Yeah.
Okay.
Yeah. It's C. I'm sorry. C is,
Okay.
yeah. So you got that? Did you guys get number 12?
Yes, I have C.
Yay.
It was
Okay.
tricky at first, but I
Yeah.
went back and I noticed all of these codes were singling out each like nose, rectum, and all of the different body parts. But when I went to 76010 and it just state what actually was the exam was based on, that's when I
Yeah.
got it.
Perfect. Number 13 is a PET scan. When you're looking up PET scans, if you're going to use the index, you're going to use nuclear medicine. A PET scan is performed via nuclear medicine, and it's a diagnostic test, right? And basically, you also need to know the definition of PET. You know what? On the back inside cover of your CPT, just in case over the course of the last 3 months you haven't looked in the back, but there is common abbreviations in the back of your CPT book, that back inside cover. And I do believe that PET is back there. So I'm just, letting you know this. Don't forget that it is back there where the acronyms can give you what the definitions are. Because I know some of us are like, what does this mean? What does that mean? Some of the frequent abbreviations or common abbreviations are listed on the back inside cover of your CPT. Okay. So for number 13, the correct answer is A as in apple.
Got it. Oh,
Yep,
oh,
A as in
Got it.
apple. I'm going to go through these.
got
I
it.
know we got a lot to cover. 14, C as in cat. C as in cat for 14. 15 is also C as in cat. And then 16, B as in boy. 17. 17 is A as in apple. 18 is also A as in apple. 19, A as in apple. 20, B as in boy. 21, make sure you understand. Remember, you need to have that correlation to understand whenever you see that acronym CLIA, that you're looking for one of your answers with that QW appended, right? Okay, so number 21 is D as in David. Number 22, B as in boy. In vivo means the living body, or in the living body. 23, number 23. Number 23 is C as in cat. Okay, so what you could do is just going to give you that code range for number 23. I just wanted to make sure we pull out the right things out of this question, because you are going to have quite a few surgical pathology questions. And they're just talking about breast tissue for a simple mastectomy. I think we did that one. Yeah. So where are we here? 23 is C. 24 is also an acronym that you need to be familiar with. The FISH test. Number 24, the answer is A as in apple. Okay. I don't know if I said 23. 23 is C. 24 is A. 25 is also A. 26 and 27. C as in cat. 28 and 29. B as in boy. 30. C as in cat. Okay. 31. This is talking about the laboratory panel. And remember, if there's an additional test being performed, you're also going to add that additional test. So if you said B for number 31, you are correct. Okay. Number 32 is also one for the glucose blood test, right? Number 32, the correct answer is C as in cat. 33 is C. Again, make sure you know the association between the CLIA and the QW. 34, D as in David. 35, yes, you do need to know 35 for the glucose blood test. So 35 is C as in cat. And I always like your questions on the panel. So 36 is another good one. 36 is C as in cat. 37, B as in boy. 38, B as in boy. 39 and 40 is also B as in boy. So let me open up the line just in case. All right. How did we do on that?
Well,
Oh,
The
I
panel.
did good. I do have some questions, but let me count up how many. What was number one, Genevieve? I missed that.
number one. Let's see. Number one was B as in boy.
Okay, cool. Got that.
Oh, wow. Someone only missed one or missed three. That's awesome. Yay, I need that feedback. That's great. That's awesome. And there was like, what, 40 questions? So let me see. What that magic number is. Did I say 40 questions?
I missed 7. How many? What was number 3? Is number 30? Was it?
Okay, I'm just going to let you guys know no one can miss more than 12.
Okay, I missed 7.
7 is an 83, so that's awesome.
Ooh, yes.
And the person that missed 3, that's a 93. That's like an A in that section.
That's awesome.
And whoever missed 1, I'm like, what? That's a 98. All right, not too bad. That's awesome, actually. That's really good scores. And again, guys, if you didn't do too well, I will be sending out the rationale for the answers so that you can read over them. And you have to let me know. I've been speaking to people all throughout the week. And so you have to let me know when you have questions in a particular area. If it's not being covered in your tutoring sessions or when you're doing work by yourself, then I should be getting a call from you. Okay. Did someone need me to repeat some of the answers? Remember, I am going to be sending you the key, so I don't want you to go too deep into. I can definitely send you the key with the rationales. And
I'll wait for the key. I'm good. I'll wait
okay.
for the key.
All right, so let me get this presentation up then. We're going to flip back for a moment to cardiovascular. There's a couple. The reason I didn't cover cardiovascular in the 30,000s is because cardiovascular also goes with medicine and radiology. Sometimes you have to take codes from those other 2 chapters just to build a cardiology claim or record. So I kind of like to cover cardiology. I figured, I can cover cardiology and the parts of cardiology that relate to it from the medicine section. And then we'll wrap up with the medicine tonight. So let me just get this screen showing. Okay, so right now everyone should be looking at the cardiovascular PowerPoint up. Okay, there's going to be, you guys did really great, by the way, on those 2 sections. And again, if we're already doing that was the last, that wasn't even a body system. So that was the 7 and the 8. So there's going to be 10 radiology, 10 lab and path. That's why I want you to get comfortable with the different ones. Radiology, you seem to be kind of comfortable with as long as you know what the procedure is and the body part, right? And then you figured out how to kind of look for the views. And there's not going to be too many of, the ones with the views, but they definitely will maybe ask a question about a CT, X-ray, MRI, of course. A couple questions about supervision and interpretation. So always remember where the procedure is taking place, whether the provider owns all of the equipment or whether you see that word, hospital or facility. So you know that your answer is going to need to have that modifier 26. And as far as the lab, make sure you're understanding what goes in the panels. I had quite a few panel questions come through this week and spoke to some of you about the panels. Remember, if it's not listed, because I know there was a question on the homework where it said they had this panel except, I think it was like creatine or something like that. So remember, if creatine is in the panel and they're saying that they did not perform that test, then you cannot use that panel code. You're going to have to list them out all separate. The only way you can use the panel code is if they did everything in the panel and then they said they did something additional. Well, that additional, you can add the CPT code for the additional test, right? So just don't get too confused with that. But back to cardiovascular. So we're flipping back. I'm just going to mute you guys just a little bit. Just have your books open for me. And so right now I am on page 189 is where the cardiovascular system starts. The good thing about this particular system is that there are 10 questions, but remember the 30,000s cover more than just cardiovascular, right? So this should be kind of like an easier section for you because you guys were really good with like respiratory system. Remember that? That's an easy system. That's part of your 30,000s. So you're going to have a couple questions from respiratory. And then it's the lymphatic and mediastinum section. So you have respiratory, and you'll have a couple from cardio, from the cardiovascular. And then after the threes, what else do we have in here? Yeah, so respiratory, cardiovascular, and hemic and lymphatic system. And that's maybe just going to be about injections, lymphodectomies, that type of thing. And you guys had already covered that. So let me just get back to the cardiovascular system. I am going to tell you that for the cardiovascular system, please make sure that you understand the blood flow. The blood flow. And I think we spoke about that earlier, like around week 2, when we started talking about medical terminology. You do need to make sure that you have the blood flow. I do believe, let's see if I can remember, I think it's page 741, or it's going to be in my need to knows, but there's a page in your ICD-10 that actually illustrates the blood flow for you. Page 741 in your ICD-10, page 741. So just make sure you jot that page down. I believe that's where it is for the blood flow. So at least you can refer to it, because most of the time you'll have a question about blood flow at some point on the exam, and usually it's covered in the terminology section. So make sure you have that down. With cardiology, it's a pretty big section, but the main thing that I focus on in here is called cabbages, which is the third bullet point, right? Cabbages, catheters, catheter placements, and pacemakers. Okay, so we're going to spend some time on those areas. Okay. So right now I'm on page 190 on my reference page in the cardiovascular. And one of the areas that I highlight in this section are the procedures that are performed on page 207. Those are where you're going to find the cabbages. So CABG stands for combined arterial venous graft for coronary bypass. So it's coronary arterial bypass graft. It's the actual procedure. Make sure you highlight that. Okay, so that you know we will be discussing that. That's definitely a page where you need to highlight. Also on page 191, where it has vascular injection procedures, that's going to be something else we're going to focus on, vascular injections. And then where it says, go down a little bit, it says central venous access procedures. I'm going to show you a nice little chart I like to use in reference to that. Okay. So we're just moving on the different parts of the circulatory system. A lot of the procedures are going to involve your arteries in your veins, right? Because that's what transports the blood back and forth. So the flow that I want you to make sure you understand as well as blood flow is from using the pulmonary system. We're going to discuss that a little bit, and the lymphatic system. Oh, I wonder if this will work. I think this is what I had. No, it won't work. This one, let me see. This was actually a video that I had embedded as far that illustrates the blood flow, but I will send you guys the link because I don't think I could play that through this presentation. It's not allowing me. Now, I always said whatever I have in red is going to be I'm sorry, let me just jump back again. Someone just asked about page 191. That's the vascular injection procedures, and also where it has central venous access procedures, those areas there. Okay. As far as the arteries, the veins, and capillaries, you can see that arteries, important to know. I don't know where you're going to write that in the in this little section, but your arteries carry oxygenated blood and also take blood away from the heart to the body. So your veins equal deoxygenated blood, and they bring the blood back to the heart from the capillary beds. And the capillaries are like 285. They connect the arteries and the veins. And anytime you see the term lymphatic system, it's talking usually about lymph nodes. Okay. These are just common anatomy terms. Now, and again, I will be sending out this recording so you'll be able to watch it, stop it, pause it, take your notes based on the slides that you see here. As you can see, I have circulatory systems, I have stars next to it, so you know that this is going to be something that you need to know. This is a little breakdown of the blood flow, okay? So there's 3 different circulations. So you have your pulmonary, systemic, and your coronary. Starting with your pulmonary circulation, it pushes deoxygenated blood into the lungs, then carbon dioxide is removed, and then it flows to the left atrium. You need to remember that. It comes from the lungs, and then blood flows to the left atrium. So for the pulmonary circulation, the blood's going to the left atrium. Okay. Then we get to systemic circulation. And so from the left atrium, it goes to the left ventricle. Right? From the left atrium, it goes to the left ventricle. And then your coronary circulation is just the movement of blood through the tissues of the heart. Okay. And also, again, remember page 741 in your ICD-10 book, right? There's already a diagram there. So just make sure, you might even want to take a little tab on page 741 and just call it blood flow, so you know exactly where to go. Okay. And then the portal system, as far as the circulations, takes the blood from the intestines to the liver. And then from the liver, it goes to the heart. So you do have what they call your great vessels. And sometimes these will have a modifier. It will see like, it will say like LC for the left common carotid. Okay. Then you have your pulmonary trunk, which pushes everything out to the pulmonary arteries. And then you have your superior and vena cava. And as far as the anatomy of the heart, you have your 4 chambers, 3 layers. They won't really ask, let me go back, I'm sorry, about that, but you do need to know there's 4 chambers, 3 layers, endo, and then your myo, which is your middle, and your epi, which is on top. Cardium, around the heart, the layers around the heart. Sometimes they may ask about blood pressure, right? And you need to know what the normal blood pressure is, which is 120/80. And that it is basically measuring the pressure within the blood vessels. So just make sure you jot blood pressure down as one of your need to knows. And they may ask the difference of those 2 phases. They may ask the difference of those 2 phases. Right? So we know with the systolic, blood is ejected from the ventricles. And what's important here is that's where it's the highest pressure. Systolic is the highest pressure against the walls. And then your diastolic is when they relax. So systolic, highest pressure, diastolic when they relax, when the ventricles relax. Okay. Definitely a common I-10 code is going to be hypertension. I'm sorry, ICD-10 code is going to be I-10 for hypertension. And remember that there are guidelines for the hypertension, right? If it's combined with something else. These are some terms. If you're not familiar with them, you may want to jot them down in the 30,000s area. CPR is something you're definitely going to see again. Okay, pacemakers and defibrillators. They have their outline in the presentation, but I like to show you something. On page 195, right? This is a table for pacemakers. I'm going to show you two ways. And you're going to tell me which way you like better in the chat box. So at first, we would need to have a couple of questions so that you can see where I'm going with this, and then you can decide which way is easier for you. So on page 195 in your 2016 CPT book, you'll see a chart, right? This is the pacemaker and defibrillator. It's basically two systems, right? Sometimes pulse generator is what they call the battery, or the battery is also called a pulse generator, right? And so on the left-hand side on page 195, you'll see all the different procedures. What I suggest, so it doesn't confuse you, is that you can block them off. Like the first four you can see are for insertion, right? So this is if you're putting in a pacemaker or you're placing a defibrillator. So of course, when you're reading your question, you need to know, is this in reference to a pacemaker or a defibrillator, right? So the first 1, 2, 3, 4 are for the insertion, and that's inserting the leads. And as you can see, pacemakers can either have a single lead or a dual lead. Okay, and they could also be inserting the leads without the sometimes it's just the leads that need to be changed, right? Your battery or the pulse generator may already be there. Okay, so that was the insertion of the leads, right? So make sure you write leads on that block that you just blocked off there. And then the next 1, 2, 3, 4, 5, 6, 7, where it says initial, where it all starts initial, that's another block, right? That's another sectioned off. And it's either they're inserting the pulse generator with the leads or a defibrillator lead. So you have to make sure you highlight, this is the pulse generators. Okay, make sure you highlight those. And where it says upgrade, the next one underneath the initial pulse, where it says upgrade, single chamber system to dual chamber system, just make sure you highlight that. So they could have one lead and now they're upgrading to a dual lead. And we're going to talk about the different types of leads in the presentation. I'm just going over this little chart right now. And then the next section you could block off is going to be your removal. So you see where we're going. We have insertion. That's just to do, it could be with or without a pulse generator. So you have to look at that. But we know that's the insertion of the leads. This is in reference to leads. And then the second block we have is in reference to the pulse generators. And then underneath that, we're going to upgrade from single to dual leads. Because you see, it gives you the answers right across from it, right? Whether it's a pacemaker or whether it's the defibrillator. So far, so good. And then you have your removal. 1, 2, on that third removal line, it says removal of pulse generator with replacement Do you see that with replacement? Make sure you highlight that. And that's for a dual lead. The one right above it is single lead. So you have to make sure that you're pulling out these main terms. Okay, so those are removals. Okay. Now the second way I'm going to show you, and then I'm going to have to pull up a question or give you a question so you can understand where I'm going with this, is you can turn all the way to the index. I actually like to do the index, but some people like to use the chart that we just had on page 195. So you can turn to the index and go straight to the term pacemaker. You can turn straight to that word, pacemaker. All right, so pacemaker is located on page 922. And there you can see all of the procedures that are performed on pacemakers, right? Let me tell you a few that I want you to highlight if you're already back there on page 922. So right now I'm on page 922. I'm looking at pacemaker, heart, and I'm dropping down. And the first thing I want you to highlight is where it says evaluation and programming. Right, so if I have evaluation and programming, more than likely they're going to be talking about the leads, right? Just make sure you highlight evaluation and programming because it will state that in the question. Then I want you to drop down to where it says insertion, highlight insertion, highlight pulse generator only. Remember, that's your battery. Okay. Then leadless system, and then placement. So that's all. Placement is an important one. Highlight it, put a little star. Okay. Removals also important. Putting it in or taking it out. Repair, because that's where your replacement comes in. What are they going to, then you have replacement. Repair, they just have for the electrodes. So remember, you can insert an electrode under insertion, or you can repair the electrode that's already in place. Okay. And then repositioning. Okay, so let me go over those again. Evaluation and programming, insertion, pulse generator only, leadless system, placement, removal, repair, and repositioning. Okay, so here back onto the slide, I'm just flipping back over to page 195, but back to the slide. So your pacemaker system, again, you have your generator, pulse generator, which is the battery, and then you have two leads. I believe they have an image of it in your HICS book. You have two leads or leads, either one or, remember, there's either a single lead or a dual lead. Okay. And then as far as the chamber for the pacemaker, it's either going to be, you need to know about, as far as coding, is it single or is it dual? And what actually are they fixing? Are they going to address the electrodes, which are your leads? Are they going to address the battery or the pulse generator? Remember, just want you to understand what we're talking about, or both, or are they addressing both? They may need to remove the whole system, including the leads, or they may just need to exchange the leads and leave the battery in there. So you have to kind of read in your question on what they're going to do. I will tell you that this section is, a lot of people freak out about cardiovascular, but there's only going to be about 2 to 3 questions in reference to the cardiovascular because you still have other systems within the 30,000 category that they have to test you on, right? And so for me, I like to make sure for cardiovascular that you focus on some of those key areas, pacemakers and defibrillators being one of them. So here again, a permanent pacemaker includes a pulse generator, which is the battery, right, containing electronics and a battery. And also it has one or more leads, remember single lead or dual lead. And where do they place this device or the generator? They're stating is placed under the skin or below the skin, subcutaneous pocket, right? Created underneath the abdominal muscles or just below the rib cage. Okay. And where do we put our leads? The leads are the electrodes, and those are placed through a vein. Or they say it may be placed on the surface of the heart, epicardial. And this is the approach, thoracoscopy, which is across the chest or opening the chest. That's a thoracotomy, thoraxotomy, opening the thorax. Thorax is located in the center of the chest. So we spoke about the different areas where we can find like replacement, right, or insertion. So you have your you do have your page 195, or you can go to the index. And like I said, with cardiovascular, you may have to choose a code from radiology or medicine, dependent on the scenario, right? But please note that if you do need a radiology code, once you have found your cardiology code, if there is radiological or radiology guidance provided right underneath it in your parentheses, is going to say for radiology, see, it will tell you where you need to go. Okay. And also, you want to make sure when you're reading your CPT code description that radiological guidance is included, because if it's included, then you do not need to append that radiology code because it's already in the CPT description. So this was just talking about insertion or replacement. We know where that chart is. And this is in reference to the pacing. Let me see if I can get to where I need you to know. Okay, so here we have, because I'm glad that this is an example up here on the screen. So let's look and see which way you like to use it. This is a good slide to see whether you like the chart, because this is going to determine how you're going to answer this section on the exam. You need to know, do I feel comfortable with the chart, or do I like going to the back to the index? Okay, so let's see what's going on. And I'm just going to open the line because I do want to hear your feedback as we use the books. So let me do that. So please make sure that your phone is on mute. Unless you're going to participate and talk, please make sure your phone's on mute. Okay, so patient underwent what's going on? Removal of a complete, what type of pacemaker? Dual pacemaker system, right? A dual implantable defibrillator system was placed. So now they're telling you they took out the dual pacemaker and then they implanted a dual defibrillator. Okay. And that dual defibrillator had how many leads? 2 electrodes. Remember, leads are also called electrodes, along with a biventricular electrode with use of fluoroscopy. Sounds a little confusing, but remember, when you're reading these questions, remember the body system that you are in, and remember the keywords that you know you need to be looking for, because you're looking for all the action. Okay, I'm saying to myself, this is a cardiovascular question. I can see it's going to be about pacemakers, right? So I'm trying to look at the type of pacemaker, because they said they came in. I got my highlighter. Patient underwent what? I'm going to highlight removal of a complete dual pacemaker system. So first of all, we know that has to be coded. right? Removal of a complete dual pacemaker system. Right? And if it says system, that means it's the battery and the leads, not just the battery. The system itself is batteries and the leads. Okay? So there should be 2 removal codes because they have to remove the leads and they also have to remove the pacemaker because I see the term system there. That's letting me know the battery and the leads. Otherwise, they will identify, they'll just say patient came in for removal of electrodes. And in your head, you're like, okay, that's the leads. How many? Is it singular? Is it single or dual? Right? That's what you're going to ask yourself. Or they'll say, removal of the the generator. So that's the battery. But once they say pacemaker system, that is including the battery and the leads. So the key word there is system. So they've removed that, and that's where you're going to get your CPT code 33235. Look at your page 195. We said removal. Drop down to removal. Don't look at the screen like you're confused. I can't hear you, but for some reason I can feel somebody just staring with confusion. But look at this sentence, removal of a complete dual pacemaker system. I'm looking at page 195. It said removal. I'm dropping down to removal. And what type does it say? It says a dual pacemaker system. So you should have for your first answer 332, because we took out the, 33. So that's your generator, that's the battery, right? The pacemaker. And then you also, and you notice it says without replacement next to it. Okay, what else was removed? The leads, because I said system, so you have to code for the pacemaker, and now for the leads are going to be CPT code 33235. Make sure you highlight leads on page 195, right? And that says dual lead, it doesn't say single lead. That's how you get your 33235. Now what are we doing? Now they're going to insert, because it says placed, a dual implantable defibrillator system was placed. So that means that's an insertion, right? Insertion. So we're going to go to insertion, which is up to the top. Insertion, which is up to the top. And what did they insert? They inserted your defibrillator, the pacing defibrillator. And it's telling you that's either for the leads, it says the leads or the generator, right? So that's where you get your 33249. And if you're looking on page 195 at your chart, again, you're going to look at the initial, because remember your insert was just in reference to leads. That was just in reference to leads, but now we're talking about the actual defibrillator, which is on the far outside column on page 195. And then it tells you here. So that would be your 33249. And then the last thing that they did, it says along with a biventricular electrode. So you can see there. So if you go down to initial pulse generator insertion, and then it also tells you plus insertion of the leads, transvenous leads, and it says multiple leads because it was 2. And if you go across with your finger to the end, it will give you those 2 codes. It will tell you 33249 plus 33225. Do you see that there? Let me open up the line. I just want to get a little feedback from you guys. Does everyone see how I just broke this question down? I can hear you. Or did I?
Yeah, it's still a little challenging, but
Yeah. Well, this is the
Yeah.
first time you're seeing it. This is the first time you're seeing it. But if you saw it, I wish I'm going to see if I can pull up the questions. But the key thing is here, anytime the one thing I like about cardiovascular in reference to pacemaker is going to say pacemaker in the system. So you're going to, in your scenario. So now you're like, okay, I already know what they're talking about. It's going to be in reference to the pacemaker. I need to either be on page 195. It's maybe a little easier to use this chart than to go to the index because they're already kind of everything that happens with the pacemaker and the defibrillators are kind of condensed on one page. You see what I'm saying? Then for
uh-huh.
you to go all the way to the index and then look and then you have to go back, you're like, okay, now they took something out. Okay, now I got to go back and look for what they're putting in. Now I got to go back and see the ventricular electrodes, where on page 195 everything's happening right here. You
I
just
just
have,
want to get.
yeah,
I'm
go
sorry.
ahead. Go
Yeah, I
ahead.
just want to get an understanding. You said something earlier. You
Okay.
said pace. You said pacemaker system. That includes.
That includes your generator, right? That's the battery, and the leads. Remember, single lead or dual lead. Both of
Okay.
them together are a system. They work together to control the beat of the heart, right? But
Right.
sometimes leads can be changed. Like you could let's say this person went ahead and had all of this insert. Let's say they had the pacemaker system inserted. It could be a time where just the leads are acting up and they need to go in and just fix the lead only, not the battery, right? Because now we're talking about reimbursement. They're only addressing the lead, or sometimes they may need to. I don't know if they charge up the battery or how that works, or maybe sometimes they just need to address the pacemaker generator itself, which is the battery. But if they're addressing both the leads and the pacemaker, it's considered a pacemaker system because
Okay.
they work together. And yes, someone asked, is a multi-lead, is this in referring to biventricular? Yes, it is. So that's two leads when they say multi-leads. Okay. And we're gonna have a couple of questions. I want to make sure that I can get through this so I think once I do the scenarios with you, you'll feel a little bit more comfortable with doing it. So let me get through this and then yeah, but the pacemaker those are the easiest questions, trust me. And then the cabbage, you'll have a cabbage. And these are just the slide I have up here. This is just a wound repair when they're fixing great vessels. And all you're looking for is the name of that vessel to find your answer. That won't be hard on those. And whenever they're talking about cardiac valve procedures, if a patient is coming in to have something addressed, you're looking for the name of the valve. Let me go back, make sure. And again, one of the main things I want to make sure you get in your book and write it somewhere once you look on page 741 in your I-10 is make sure you get that blood flow. Make sure you get that blood flow in your book. I mean, it may be 2 points. Those 2 points may take you where you need to go to get that credential. All right, so make sure you get that blood flow. Make sure you have page 195. Some people will even want to tab that pacemakers. So you know exactly where to go for your pacemakers. You just need to remember that you tabbed it. Okay. And then I want to talk about the cabbage. Okay. That's a coronary artery bypass graft. Okay. So when it says venous, sometimes they'll just say veins, or you see arterial here, they'll say artery. Okay. And reoperation is going to be important. I'm going to discuss each of these that are listed here. So right now we're talking about cabbages. And where can cabbages be found, Geneve? Okay, so those begin on 335s. It's got my cabbage. I'm on page 207 right now. Page 207 in the CPT. And on top of page 207, I want you to write the word veins. You know, I got to make it a little easier for you. So make sure you write the word veins. And on page 208, at the top, you'll have artery. Make sure you write artery on top of page 208. Okay, so again, on page 2, top of page 207, you're going to have veins at the top. All right, so just make sure. So on page 207, you'll see the term combined arterial venous grafting. That means they're using veins and arteries. They're going to be using veins and arteries. And so the key thing for you to find out, because it will have the acronym or say they're coming in for venous grafting, or they will say CABG. You will see that acronym there, CABG. You need to look for the number of arteries and the number of veins in the question when you're coding for a CABG. And then you're looking to see if the patient had this procedure before, because you may need to use the reoperation code, which is a 33530. And we'll talk about that in a second. Okay. And I just didn't, can you guys hear me? I'm sorry. I just want to make sure you can hear. Someone said they lost audio. Okay. You should be able to.
I can hear you.
Okay.
I can hear you now. That was me, Janine.
Okay.
It went out and then it came back in.
All right. Yeah,
That
and I
was
just
me.
wanted to address something I saw in the chat box too, on the biventricular. Yeah, so the biventricular, I think I said it was two. I thought someone asked about the multi, but the biventricular, usually there is a lead in the right atrium, and then they'll place the other leads like in the right and left ventricle. So those would be 3. So I think Sandra had said something about that. So yes, that's correct. But back to the veins on page 207 and the combined arterial grafting for the coronary bypass graft, you will see, look at CPT code 33517 and 33518 and 19. You notice that these are add-on codes, right? These are add-on codes. And so remember I said you're going to look for the number of arteries and then for the number of veins when they're combined. Okay, so if you look at underneath CPT code and make sure you read that little paragraph that's there on page 207. But if you look at CPT code 33517, it's going to tell you what codes you need to use that add-on code with, right? So they tell you 33533, right? So basically it's grouping. This is for your veins. So it's going to tell you which artery code it goes with. So if you look at CPT code 33517, it tells you use it in conjunction with. This is so 33517 is a single vein graft. And if I was to say 3 coronary arterial grafts, then you would turn to page 208 and you would choose 33535. Right? So you're looking for how many arterial grafts and how many venous grafts. right? Because you can see this is a vein graft on CPT code 33517. So these particular codes are used to report a coronary artery bypass. Okay. 33510 through 33516. Okay. 33510, that starts on page 206, just in case you're trying to follow along. Page 206 in the CPT code, 33510 through 33516. Remember, those are veins only. Those are your veins only. What I just went over was a combined veins and arteries. Okay, so it tells you those codes 33510 through 33516 are not used for combined arterial venous grafts. Okay. And then as far as the procurement of the saphenous vein, it gives you a little blurb about that on the top of page 206. Okay. And it will, if they're procuring the saphenous vein, it will be mentioned in your question. It's not something that you have to decide whether it's done, but it is something that it's an add-on code, and it's not something that you would just automatically pick up. Okay, so it would be described in the scenario. Okay. Saphenous vein is the one that is common with a CABG procedure, them using the saphenous vein, but also note that they may also use an upper extremity vein like they have listed here, or femoral popliteal. But for the most part, on the exam, they will be discussing procurement of the saphenous vein. Okay. Now the arterial, remember we just did the venous grafting, right? And then your arterial grafting is your 33533s, which is on page 208, right? That was your arterial grafting. And if it states here at the bottom on this PowerPoint, on this particular slide, it tells you if they're going to procure a graft from the upper extremity, so it would have to say upper extremity, you would use CPT code 35600. 35600. And I know it sounds a little confusing, but please make sure that you read the information on page 207 and also the paragraph that is on page 208 as far as the combined grafting. But again, I don't want you to get too caught up into this one section. I need you just to remember how many arteries, how many veins. And if you see CABG or combined arterial, that means they're looking from one area, from the arteries, and the other from the veins. See, this is back to the two previous slides we just covered. One was just strictly talking about veins, the other was starting about arteries, and now we're here back to 207 with the combined, right? So remember that your 33517 through 33523 are add-on codes. The 33530 code is the reoperation, and then you have your arteries, and then your veins. And we already wrote that on top of each of those pages. Okay, let's see here. So as you can see, this is like, let's see if they have it here. If you can see your arteries. Okay, so this patient came in to have a coronary artery bypass, okay, with left internal mammary. That's just the artery that they're using. To the left, this is where they're doing the bypass from, using the left internal mammary artery to the left anterior descending. So you can see here and they have an arterial graft. So that means they have a venous graft. And then they also did it from the saphenous vein. And then it says harvesting the saphenous vein. Remember I said they will have it spelled out for you. It's not something you're going to have to create. It says was endoscopic. So here they have that there was 2 arterial grafts. And then your 1 venous graft here. And then the harvesting of your saphenous vein. And when I have, once I get to my questions, I'll be able to break it down a little better for you where we can highlight as we go through. Okay. Those are cardiac anomalies. The only 2 you need to be concerned about here are your septal defects, which is CPT code 33641, which is on page 209. Septal defects, those are repairs. What else do I need on that page? I'm sorry. And then on page 210, highlight CPT code 33647, where it has repair of an atrial septal defect and ventricular septal defect. I want you to make sure you highlight where it says atrial and where it says ventricular. Okay, in CPT code 33660, please highlight where it says repair and where it says atrioventricular. Okay, so again, CPT code 33647, you've highlighted atrial and ventricular. 33660, atrioventricular. And then 33665, where it says transitional atrioventricular. That's the key word there, it's transitional. I think that's all they may ask. Okay. Page 218, those shunting procedures, 337. I have that highlighted. That means you need to know it. For the shunting procedures, starting with 337, 35. That's also going to be on, should be in the same area, on page 210 at the bottom. And when they're talking about the shunting procedure, make sure you highlight CPT code 33750. And as you can see, the difference between 33750 through 33762 is the path. Like with 33750, you have subclavian to pulmonary artery. And then 33755 is ascending aorta to pulmonary artery. And 33762, descending aorta to pulmonary artery. Not going to need that one. And these are just letting you know the various arteries where the aneurysms can occur. This term here, thromboendarterectomy, please make sure you have the CPT code range, which it is listed here, 35301 through 35390. Okay, so that's just removing a thrombus or clot in the vessel. And again, here it does have, like if it came back within, I think the time frame they have here is listed more than 1 month after the original operation, you would use CPT code 35390 in conjunction. It tells you there, 35301. That's for the thromboendarectomies. And we spoke about the bypass grafts. Oh, yes. There's another thing I need, you guys. I am on, What else do you need to know? You need your catheters. And your catheters, I want you to use, and then I'll talk about those in a second. Okay. Turn to page 230. Where is it? 233. Page 233. And on top of that page, I want you to have Appendix L. Appendix L is called, in the back of your CPT, is your vascular families. Vascular families. But on page 233, on the right-hand side, I want you to highlight the section where it is explaining CPT code 36221 through 36226. It's about the 1, 2, 3, 4th paragraph down on the left-hand side on page 233. And it starts with codes 36221 through 36226. Do you see that? And then about the next paragraph down also is telling you how to report this code. So it's going to be important for you to read it. Okay. And these are called vascular families, what you would be reading about. And so on page 234, under CPT code 36215, I want you to put the first order or highlight first order. 36216, I want you to put second on the outside. And let's see. And on page 235, on top of CPT code 36245, I want you to write the following terms: abdominal, pelvic, and lower. Okay. Abdominal, pelvic, and lower on top of CPT code 36245. Oops. Okay, and then next to CPT code 36245, that's going to be your first order. 36246, that's your second order. And 36247 is your third order. And on page 236, underneath us or next to CPT code 36251, I want you to write the word renal. That's where your renal arteries selective catheter placement, that would be your code 36251. If it is bilateral, then you'll use 36252. Okay. And if they say super selective catheter placement of the renal artery, you will use CPT code 36253. So make sure you highlight super selective catheter placement and right underneath it where it says renal artery. Right? That's super selective. CPT code 36251. Make sure that you've written renal. And this is also the first order. And if it's bilateral, it will be 36252. I was talking about Appendix L. That's found on page 757. Right now we're on page 236, but I'm flipping back to 235 just so I can go over that again. So on page 235 is at the bottom where it has 36245. It's gonna cover. This is where the catheter can be placed, right? Either in the abdominal, pelvic, or lower arteries. Okay, 36245, they will tell you in the question the order. Okay, so 36245 is your first order, 36246 second, and your 36247 is your third order for the abdominal, pelvic, and lower arteries for the selective catheter placement. Okay. And on page 234, where it had CPT code 36215, where we wrote first and second, those are covering the thoracic or brachiocephalic arteries. Thoracic or brachiocephalic. It's actually in the CPT definition of 36215, the spelling. The last thing, is this the last thing I want to cover in cardio? Let me see. I have to show you the chart. Okay. All right. I'm on page 240. This is what they're talking about, the last bullet point on this slide where it says, see the CVAP table in CPT. CVAP stands for Central Venous Access Procedure. Okay, so this is where they would be either inserting a catheter or some type of monitoring device. So there's steps on how to use this table. Okay, and usually in the question for you to know to come to this page, it will state that the provider was going to perform a central venous access procedure. Okay, and so once you see central venous access and you know you're in the 30,000s, you should be on this page, page 240. And then you're going to ask yourself, what is the action that's going to be performed? Do you see the black headings on this chart on page 240? The first one says insertion, and then the second is repair, and then you have partial replacement, and then you have complete replacement, then you have removal of obstructive material, and repositioning of the catheter, right? And then also on to the far left-hand side, you'll see that it's divided by whether it is a catheter is being addressed or a device. Sometimes they'll say venous access device, right? So venous access device, then you would be looking under device, or they'll say catheter, right? Or they'll say catheter. Now, when you are coding, there's a couple of steps. I'm on page 240. There's a couple of steps to code the central venous access procedures. The first one is you need to know whether it is what procedure you're getting ready to do. That's first, right? From the black line. So you know what section you need to be in. Let's just, usually they'll maybe talk about it insertion. So let's just stay to the top half of the page. You shouldn't be below the repair line if I say insertion. And once I state that the patient is coming in to have central venous access, you're going to ask yourself, okay, what's being inserted? Is it going to be a catheter or is it going to be a device? And it will say that in the question. Patient came in. The second thing you need to know is the age of the patient, whether they're under or over 5. Under or over 5. And whether, again, they're having a catheter or a device inserted, whether it's tunneled or non-tunneled, with or without port or pump. That's going to be in your question. It's actually going to, all of those terms are going to be in your question. But you should be able to answer the question by using this page like a grid, right? Using it like a grid. So if I said, a patient was coming in, a 50-year-old patient was coming in to have a venous access device with tunneled with port. If I said a patient was coming in to have an insertion of a venous access device and it is tunneled with port. Okay, or you could have tunneled with pump. If it was tunneled with pump in the chat box, what would my answer be? Patients coming in to have a venous access device inserted, and that device is tunneled with a pump. With a pump. Tunneled with pump. Not port, pump. Okay, waiting. Chat box. We're looking at page 240. I need one more answer to confirm the ones I have that have been entered. Remember, they're coming in to have a venous access device inserted, and that device is tunneled with a pump. Okay, thank you, ladies. Correct answer, 36563. 36563. So I think you're understanding, okay, what about if they are coming in to have the venous access device, which is the catheter only. It says catheter, partial replacement of that, and it's tunneled with pump. Partial replacement. Perfect. Yay, you're getting it. Okay, I can smile. I know it sounds a little confusing, but that's why I like to try and do little short scenarios so you can understand. The correct answer should be 36578. As a matter of fact, that's the only option there, right? That's the only one there. There's no guessing. So one last one. They're going to remove a catheter, and that catheter is tunneled but does not have a port or pump. They're coming in to remove a catheter. That catheter is tunneled but does not have a port or a pump. See how fast you guys are doing these? One more, and I'll stop. I didn't even say ages, but I think you're understanding if there's nothing else to choose from and that's there on that line. That's correct. 36589 is the correct answer. If that's all that's on that line. What about a repositioning? Repositioning of the catheter that is centrally tunneled. Repositioning of the catheter that is centrally tunneled. Perfect. And I'm going to try one more just so I can make sure you're understanding the less than or a greater than for the age. Okay, so a 70-year-old man, let's see where I can go. No, let's see if they'll get this one. Right, so a 70-year-old man comes in for a catheter placement, non-tunneled. Catheter placement, non-tunneled, and they're 70 years old. Final answer, please, using your chart. If he's coming in for insertion of a catheter, he's 70 years old and it is non-tunneled. Answer in the chat box. Non-tunneled. He's non-tunneled. Just remember the alligator. This is how I remembered it in elementary school. The alligator eats the bigger number. So that first one where you have five, there's two columns with 5 years, right? So the first one we have is over 5, and the second one is less. Okay. So for your catheter, make sure you write that in the box too. So for that particular question, your answer would have been yes. 36555. Once we got that clarified, it made our answer a lot clearer, right? So make sure you put over and less than 5 in those two boxes so you know which ones to use. Okay. Woo, that made me feel good. All right, so the procedures again, just so you can remember the steps for the venous access table, because you're going to get maybe 1 or 2 from here, but as long as you, and you did, we did about 4 different scenarios and you guys aced all of those. Remember the 4 steps on this page. You want to write them at the bottom. Step 1, what's my procedure? What are they getting ready to do? Are they going to do an insertion? Are they going to repair? Are they doing a replacement? So I know which category with the black bold line on the page, what section I need to be in. Then you're going to ask yourself, the device that they're inserting or whatever they're getting ready to do with, is it tunneled or not? Right? Because then you can move your fingers over on which column you need to be in. Third, is there a pump or a port? With pump, with port, or is it without? And then the last step is the age of the patient. All right. So again, you have your procedure, whether it's tunneled or not, with or without a pump or port, and then the age of the patient. And I will tell you the common ones, the tunneled with pump for the venous access device, that CPT code 36563, that's a common one. So you might want to highlight that. That may pop up. That's tunneled with port. And also the 36558. 36558 is another common one on those. So that was a good one, the venous access. Appendix L, I did let you know that is on page 741. Let's turn back there for a quick second. I'm on page 741. And you may, wait, is it 741? I'm sorry, 758, 757. Ooh, Geneve, sorry. Page 757, that's where Appendix L starts, where you can see vascular families. And remember how this is just like an illustration. When I had you go next to the CPT code and I was right, I said put abdominal, pelvic, and then first order, second order. Basically, this is a diagram of that. Okay, this is a diagram of that. So let me see how I want you to write this in here. On page 357, you may not come back here when it's exam time because you already have it written next to the CPT, but I want you to have information in both places. If they're doing non-selective placement, sometimes they'll say non-selective placement. It's usually the aorta that they use for the approach, and that's not on this particular page. But at the top of the page, 757, next to Appendix L, I want you to write CPT code 36200, 36200, and put aorta, aorta, non-selective. So that's non-selective placement. It already starts there, actually. It's the starting point, the aorta. Okay. And do you see where it says first order under vascular families? That's going to be your 36215. You're going to put that under first order 36215. So if they say that the catheter was placed in the common carotid, do you notice that common carotid is at the bottom of this page on the right? I'm sorry, on the left common carotid, that's going to be 36215 because that's in the first order. See where I'm going? Second order branch is 36216. These are CPT codes, by the way. 36216, and you can see in the second order branch, you're going to find your common carotid, your subclavian axillary, your internal carotid, and your external carotid. That's in your second branch. These are the vascular orders, the families. Third order, 36217, and beyond the third order, 36218. So wherever it's placed, the catheterization in these particular, what's involved in these branches will be in your question, and then you would just use the corresponding CPT code for those orders. Turn to page 758. Page 758, at the top where it says first order, you're going to have 36215. Now these are above the diaphragm. Above the diaphragm. Actually, draw a line where it says bronchioles. Do you see that? Where it's, when you're looking at the first order, take your finger down. You'll see left subclavian axillary, and then you'll see intercostals, and then you'll see bronchioles. Draw a line onto bronchioles all the way across to the other side of page 758. So above that line, are those vasculars above the diaphragm, right? And below bronchioles, if I'm pronouncing that right, that's going to be the below the diaphragm. I want you to write below the diaphragm. I know this page is throwing you off. I think you're going to be fine using the regular CPT because we've already wrote them out by the side. Okay. So again, let me just try and see if I can summarize this for you with the slides that we have up. So we're talking about selective catheterization, right? So we were talking about first, second, and third order. Remember, we had our page where for the primary, remember the first thing runs off the aorta. And if it runs off the aorta, you're going to use CPT code 36200. Right? And then remember, we had our, what page were we on? When we got to the brachiocephalic artery, right? That was on page 234. Okay. And then you had your secondary. Remember, they had primary. I'm sorry. You had your first order, second order, then your third. So this is just talking about the various vascular families. So your second order, you're going to have your common carotid. Okay. And then you have your third order vessels. Right external carotid. You'll see that there. That's what we just looked at on page 757 and 758. Yep. And if you look on let me show you something. If you look back on 757, the way that I just gave you those CPT codes, if you take your finger across, because the question may say it was in the third order and it was the right internal carotid, just like this on the slide. But if you look on page 757, and if they say that now, you're like, okay, 36217, you got your answer, because that's how you use it. All right, let's go there. And we spoke about above the diaphragm, below the diaphragm. So you have kind of that scattered in your book where you need it to be. And this is just the placement of those. Let me go back so you can see that 362. Okay, so again, if it's the first starting point is the aorta, you have your 36200 right there. It's going to tell you to check Appendix L. Back in Appendix L, We already have those kind of, the page they use. We have the CPT codes on there for you already. Go back. These are just some terminology, more terminology in the cardiovascular section. Now, I was telling you about some of the modifiers you may see in the cardiovascular procedures. RC stands for right coronary, LD, left anterior descending, then you have left circumflex. So you'll be looking for these terms. They will be in your question, but remember that the modifiers will also be appended onto the CPT codes. And we spoke about the septal defects. I think this is the last slide on that. Again, common modifiers in the cardiovascular section. You got 26, which is discussing the provider interpreting the report. TC, modifier TC is the actual performance of the procedure, like going to a technical school. They're doing the hands-on portion of the procedure. This is letting you know the direction of the coronary artery that's being utilized, which is the left circumflex, left descending, right coronary. And of course, with cardiovascular procedures, you're definitely going to have assistance. So 80 is for assistant surgeon. Don't get it confused with modifier 62. Modifier 62, you'll maybe see more in the nervous system, which is a co-surgeon. So they're doing equal parts. 51, multiple procedures. 52, reduced, right? So it may be something that's bilateral, but they're choosing to just do it on one side, and the CPT code states bilateral, so you would append 52. All right. And this was in the vascular families, but we already had that on page 747. And remember here in red, it says assumes the start is always off the aorta. And if that start is off the aorta and it is non-selective, which you see I have in red, in the chat box, what would the CPT code be? Chat box, chat box. Don't forget, your 36200. So we did those. All right, so this is just like, and again, I will be sending this. And you could just see how, because I know what I'm writing and you can't really see it, but you can see how I kind of broke up my page. So that will be, of course, sent to you when I send out the presentation. I know you guys are like, whew, good. But for the most part, you'll be back in the front of the book because you've already written those to the side. Okay. And this is the coding for the bypass. I think that's all I had. And these are also, when we were talking about first order, second order, the page 747 in the back, this is more of a more clearer diagram showing you the different orders because they're color coded. And actually, I had someone in the class in the Facebook group. She also shared in the group how she has actually labeled hers along with the CPT codes next to the name of the arteries. So that's a good thing to have in there. She actually drew this in her book. Okay. But that has been shared in the Facebook group. But you also have this. Remember, we just did this in Appendix L and also in the chapter itself. Good job. You only have 3 or 4 questions coming from cardio, right? So here it tells you never go beyond the first order. And you will have this again in the recording presentation. Let's see if I can get this out the way here. So this is the aorta, the image that's on the right-hand side. Looks like a little C, half a donut, past dinner time. That's the aorta, right? So remember when it starts there, because it didn't go anywhere, it's like you're getting ready to go onto the expressway. right? And you start at the aorta to go on to the ramp. If you start there, it's CPT code 36200. I did see you guys place that in the chat box, and that's great that you have it on top of your head because you're going to see that question again. Right? So let's see, 362, then it exits, just like an expressway, exits into the left common carotid. And it says never go beyond the third order. And in the back anyway, on that vascular family page, we do have it with the CPT codes 36215, 16, and 17 in each of those orders. So you'll know all you'll be looking for is the name of the artery. Okay, and you'll already have the CPT code back there. All right. So let me just change this out to the medicine and just open up the line. And I know you guys are like, whoo, that was a little confusing, but I will tell you the parts that they're most likely going to ask in cardiovascular is going to be pacemakers for sure, a cabbage, and you'll maybe have one question from the vascular families where you already know because you have it written out next to the code. And then definitely from that catheter table, make sure you have that catheter table or you know how to get to it quickly. Once you see a question that says central venous access device, you need to be running straight to page 240. I like how you use that because you guys answered the questions really quickly with just using the chart. So definitely the chart. And also you did it with the pacemakers. I know I told you can go to the index, but remember there's a chart right there. Tab that page, call it pacemakers. Tab page 240, call it venous access, some CVA or something where you can get to it quickly. Does anybody have any questions? Because I know cardiovascular can be quite complex. I don't want to overwhelm you with it so much because I know there's not exactly 10 questions, but I do know the areas, and we did cover some of the key areas that you would be tested on. Of course, when you have the questions is where you're really going to see if you're understanding the material. So it is important that you attempt this cardiovascular, hopefully before we meet again, so that I can address any questions that you may have in reference to it. Okay.
You will be, you're going to send homework. I'm sorry.
Yes,
homework.
I'm going to send you some homework. The homework I'm going to send out is going to be about 30 questions, and there's 15 from cardiovascular. So, I picked them from different sections, and then you'll get the other 15 from medicine. Medicine is going to be more of like your vaccinations, and it's kind of like an E&M a little bit, but medicine also houses like catheters and stuff like that because it's not actually procedures like a body system. It's just a chapter to support the other chapters with things they may need, if that makes sense. But we're going to talk about that right now. So let me just close this one down. But yeah, any questions? Because I know it can be cardiovascular is very complex. But I don't want you to get too carried away with the main sections, not to say you're not to know about the other sections, but the main sections that you're going to be tested on are those common procedures like pacemakers and stuff and cabbages. And that's why I choose to focus on those particular areas in cardio. Because remember, there's 10 questions. And I taught in cardio, I just covered about 4 or 5 different things. There's 10 questions, and only maybe 3 of them are going to be in reference to cardiovascular. So I don't want you to pull your hair out over it. All right. Let's see if I can show you this slide. And this one will be, we should be out of here by 9. But you're already home, so that's great. So everyone should be able to see the medicine. Did anyone have any other questions? I know as you go, you get the homework and you read through it. If you have any questions, you'll contact me. But is there anything that I can address before we move on to the medicine section? You're like, not right now until I get my homework. Okay, got it. Got it. All right, so now we're on medicine. We're flipping all the way back to the 9s. Oh my goodness. Wait a minute. So we're almost done. Next week is E&M. I'm not going to try and start E&M. I'll take all of next Thursday's class for E&M. You'll need it. Not really. Actually, E&M's my favorite. All right. One of my favorites. I'm on the medicine section. I'm looking at page 575 right now. I'm just going to go ahead and just do the mute. I'm looking at page 575. All right. And in the medicine section, there's definitely going to be need to knows. I just want to kind of give you a couple of ideas on what you need to know for the medicine section. I'm just typing a few of them in the chat box. And allergy injections. Let's see what else. Chemotherapy for sure. How to code for chemotherapy. That's just time-based. It's either an hour. We'll talk about that. Let's see, chemotherapy. And also, although there's an E&M section, which we're going to cover next week, in the medicine section, there's also kind of like E&M type services. Ophthalmology for the eyes, right? Those services, if someone's coming in to see an ophthalmologist, those sections are not going to be found in the E&M, but they're actually going to be found in the medicine. I can tell you I've had a couple of times, and I know when people get to those sections because I can see them flipping back and forth from E&M to medicine, and that cuts out a lot of time because they can't remember where to find ophthalmology. Remember, ophthalmologists, if someone's coming in to get their eyes checked, it's going to be found in the medicine section. Okay, and that's we're going to talk about it, but when they're doing the eyes, they'll also do a procedure called they're checking the refractive state, and we'll talk about that. But when they're doing it, it's either they're new or established, and you also need the age of the patient. And that's going to be a big key factor when we start talking about E&M next week. Okay, so ophthalmologist, I put that there. Vaccinations, you're going to have a question about vaccinations, how to administer vaccinations, how to administer vaccinations, the age of the patient again, and whether that vaccination is delivered with or without counseling. You're going to have maybe a question on psychotherapy. Psychotherapy, I'm just typing them, putting them in the chat box. With psychotherapy, it's basically time-based, and you'll focus on how long the session lasted and if a crisis was involved in the evaluation. And again, I'm going to go over these. Facial nerve function studies. Facial nerve function studies. That's another need to know. Facial nerve function studies. I actually have a page number for that one, page 596. Arterial studies, extremity arterial studies. PTCA, you need to know what that acronym stands for, PTCA. PTCA. I wonder how many of you are flipping to the back of your inside cover to see if that acronym is there. Remember, a lot of the common ones are located in the back inside cover. Coronary angiography. It's also going to be a need to know. Physical rehab. Those type of procedures are also listed. Rehabilitation. are also found in the medicine section. I believe that's around page 655. And then preventative medicine, like your yearly checkups, that's not going to be found in E&M. That's also going to be found in the medicine section, preventative medicine. So you can have a preventative medicine visit, which comes from this section, and then the provider could also be addressing something else, which would be an E&M code. All right, so I got that, preventative medicine. All right, so let's get started. Okay, so again, I had highlighted cardiovascular on this slide because I said that medicine, radiology, and cardiovascular, sometimes you have to pull from all of those systems to code for cardiovascular services. But the medicine section includes your immunizations and your vaccines, right? Remember I said ophthalmology, so that's going to be very important. You notice I have these areas in red, so you know that you may be questioned on those. Okay. Physical medicine, qualifying circumstances for anesthesia, you already know those, right? Your qualifying circumstance, under 1/70. And as far as, there's not going to be 10 like medicine guidelines, because it's just going to be everything in that book, really. There's not a section for medicine. All right. Important for you to know what immunoglobulins are. Okay, I do have that in red. Get this out of the way. So they're basically provided to prevent infections, and it's made from human blood, artificially created, or sometimes they'll use animal proteins. Okay. And so they say infections are caused by bacteria and viruses and fungi. And when these products are given, when they are administered, then you would use administration codes. That means if you're going to bill for giving someone some type of vaccination or immune globulins, you also have to bill for the administration of the code, for actually giving them that shot or that vaccination. There's a code for that. Look at that. It tells you in that last sentence, when delivery is by infusion or IV. You hear that? When it's by infusion or IV. When delivery is administered by infusion or IV, this is good information. You are to see CPT code 96365 through 96371. Right? That's when it's delivered by infusion or IV. So those are the keywords there. So your administration codes, if someone was going in to have some type of therapeutic administration, or if they're giving someone that vaccine, you know that you need, if it's done by injection, intravenous, right? Or if you're on a drip infusion, then you should be looking in the category 96365 through 96371. Okay, and then you have your vaccines. Let me just do this for a real quick. Look for 96365, just so we can kind of make a quick note next to it. 96365. Because I don't want you to forget that part. 96365. We're on page 650. Okay, so when did they say we're to use these? For infusions or IV, right? Infusions or IV. I'm putting it right next to those codes that they said it goes with. 96365 all the way through 96371 on the next page. Okay, that's for infusions or IVs. And it also tells you, always remember to look at your coding tip. Always look at your coding tip. The administration of medication. The administration of medications, example, antibiotics, steroidal agents, narcotics, administered independently or sequentially are, as supportive management of chemotherapy administration should be separately reported. And it tells you what codes to use. And it tells you to go back to 96360, 96361, 65, or 79. So make sure you just read that tip. And then on top it had 90476 on this slide here. Just wanted to turn back for a second. 90476 is where we're going right now. So this is in reference to the vaccines and the toxoids. So these are your vaccinations. Your vaccinations. Now look on page, remember we just said, okay, 96365 through 96371 is for your infusions and your IV, right? And then if you look on page 576, the first paragraph tells you, report vaccine immunizations. This is the part people miss in the medicine section. Report vaccine immunizations, because they get confused on which administration code to use. You're going to use 90460, 90461, 90471 through 90474. In addition, right? In addition to the vaccine and toxoid code. So they're telling you those administration codes go with that 90476 through that 90749, like those vaccination codes that we just looked at on page 578. So anytime, like if you turn to page 578, look at CPT code 90632 on page 578. That is a hepatitis A vaccine. You don't see anything on the page that tells you need to bill the administration. I mean, it is in here if you read it, but please note that the 90632 cannot be billed by itself. You also need to bill for the administration of it, right? You also have to bill for the administration of that vaccine, and it tells you where the code range is to report for the vaccines. Right? So the reporting of the administration would be on page 577. So maybe at the top of page 577, you might want to put administration codes for vaccines, or just administration, vaccine, something for you to know. That's where you get your administration codes from. Because again, you can know the vaccine that you're going to administer and you can code that, no problem, but you also have to code for the administration of it. And remember, there was codes for administrations for infusions or IV, and then there's vaccine administration codes. I need you to understand that. Because when we get to the medicine section, when you're on the testing on the medicine section during the exam, I'm not going to be there to, well, I will be there, but I can't clarify it. And I need you to feel comfortable knowing, okay, they're just getting they're getting ready to have chemotherapy, or they're going to have some type of infusion. So I know I need to be using my 96365 through 96371 codes. Oh no, she came in for a vaccination. I know I need to be looking at 90460, and those codes are going to further explain whether it was administered with or without counseling, that type thing, and then the age of the patient. That's how those codes are broken up. So it's important that you remember that when you are administering a vaccination, or whether someone is having some type of infusion, that there are administration codes that go along with those procedures. Okay. And here is just a definition of vaccinations, and also your toxoids, which helps you produce your antibodies against whatever the toxin is. Okay. Psychiatry, no, we don't need those. I want to get to end-stage renal disease services. Those are billed once a month. The dialysis services, guys, and this is just FYI, they may not ask. Just remember that dialysis services for end-stage renal disease are reported once per month. Okay. Ophthalmology services that I was talking about in the beginning, please turn to, as we're flipping through the medicine section. So as you can see, I started off on page 474, 475, just looking, I'm sorry, 574, 575, just looking, writing down some of the need to knows. Page 576 is just talking about those immunoglobulins. And then we go into the vaccines. So remember, on page 577, those are the administration codes for vaccines. There, if you look at CPT code 90460, it tells you through 18 years of age, any route of administration with, you see that, with counseling. Okay, up to 18 with counseling. And that's for each vaccine that is administered. You're going to use this. What does that mean? So if they have 3 vaccinations administered, you'd have 90460 and 90461 times 2. Remember, you have to, although multiple vaccines can be administered through a combination type injection, you still are going to code for each vaccine being administered. Each vaccine being administered. The 90471, there is no counseling. No counseling. And 90472 is your additional vaccines. 90473 is just the method of administration, which is by the mouth or through the nose. And then 90474 is the additional vaccines. And as you go through the pages, 578, 579, you can see these are still vaccines. Common ones are on page 580. Turn to 580 with me. 580. Let's see where I want you to put a star. Try 90700. That's a DTaP. That's very common, right? All children get that, supposedly. Not everybody believes in vaccinations. But you can see it's a DTaP. Look, 90700. How many vaccines is that? Put it in the chat box for me. It says DTaP, right? But diphtheria, tetanus, I think that's pertussis. That's 3 actual vaccines. So you'd have times 3. And I think they had an example in here. They do have an example. So make sure that you read page 577 and 578 so you can see how they're breaking it up. So you're going to have to make sure you read page 577, 578. Remember, each vaccine is counted when it's time for administration. Another common one is your MMR, measles, mumps, and rubella, CPT code 90707. So look, MMR, that would be ×3 on the vaccination side. Do you see where I'm going? Although it's one CPT code 90707, there's 3 components to that CPT, 90707. And then you have 90710, which is measles, mumps, rubella, and varicella vaccine. Now that's 4. Do you see where I'm going with that? So as far as your administration, it would be, you'd have your first one. I got to see how they have it listed out. So it's each additional. Yeah, you'd have to list each of those. Right, so you have an idea. So these are vaccines. And then page 582, they go into psychiatry. You won't have any questions in reference to psych. There's only about 4 codes for those anyway. Page 584, when I was talking about psychotherapy, I'm on page 584, 2016 CPT. Page 584, CPT code 90834. Next to it, I want you to write no crisis. Because remember, I was saying psychotherapy, they have it with and without crisis. CPT code 90834 is no crisis. Okay, with crisis for the psychotherapy, look on page 585, CPT code 90839. Make sure you highlight for crisis. And you can see it is billed in increments of 60 minutes, and then the additional time is additional 30 minutes. So that first code is for an hour, and then you have each additional 30 minutes. So you have to pay attention. You may want to write next to that CPT code, pay attention to time. You can write all in this book. You won't be using it next year. You have to start all over again, but it's okay. All right, so that's for your psychotherapy. Just remember whether it's with or without crisis, and also the amount of time. And it also will discuss how to bill for psychotherapy or code for it, starting at the bottom of page 583, continuing on page 584. So you have your hemodialysis on page 586. Lots of reading in the medicine section. Let's see where else you need to go. Ophthalmology is where I was heading, and that starts on page 590. Page 590 for ophthalmology. I am going to stress to you the importance of the verbiage that is on page 590 and 591. Make sure you highlight these definitions. No one's asking you to remember them or memorize them, but you do need to know how to locate them, right? I'm looking at page 590, and it's important for you to understand the definitions of intermediate, ophthalmological services, and comprehensive. Intermediate and comprehensive. Okay, so here with intermediate, let's get the highlighter ready, start to underline. It describes an evaluation of a new or existing condition, complicated with a new keyword, diagnostic or management problem, not necessarily relating to the primary diagnosis. Okay, and it tells you what they do. Some examples of intermediate services on page 591 at the top. It tells you a review of the history. Do you see that? A and B. And then drop down to comprehensive services. And I like to just highlight where it says this service includes, which is like the third or second sentence down. This service includes the history, general medical observations, external and ophthalmoscopic examinations, gross visual field. Make sure you highlight that all the way to sensory motor examination, because usually in the question it will say what was provided in the service, and then you would have to decide whether it is intermediate or comprehensive. Right? So you would have these two already here, ophthalmology. Just make sure you remember the keywords from intermediate and comprehensive. Then you're going to break it down whether the patient is new or established. Look, I'm looking at page 591. This is for ophthalmology services, and you maybe have about 2 or 3 of those questions in the medicine section, but not hard at all if you know where to find the information. We're not talking about body parts. We're not talking about surgeries. We're just talking about providers evaluating the patient's eyes. Okay, so it shouldn't be detailed or brain-wrecking for you to find. On page 591, again, it's broken into new and established. Do you see that? So you need to find out if the patient's new or established. And then there's only then you're going to decide whether the service that's being rendered is intermediate or comprehensive based on the verbiage that's there for the description, the definition of those. Okay, and then remember I was saying the refractive state. Sometimes when they're coming in to check their eyes, they're checking for the refractive state. That's CPT code 92015, which is at the bottom of 591, and I'm pretty sure you're going to have a question where you're going to need to include that. So make sure you have that highlighted with a star. Okay, so that's for the ophthalmology examination. This is for when they're coming in. So again, you're looking to see if it's intermediate or comprehensive with those function tests. Let's see where I want to go next with this. Page 597. Page 597. Those are your function tests there, and it will be named. This is so easy because all they're going to do is just give you the name of the test. And you just select your CPT code. I did mention facial function studies as a need to know on page 596, CPT code 92516, facial function studies. Make sure you put a star, highlight that. That's a common one. See what else we need. I think you're hearing the extremity arterial studies. Let's get there. The medicine section is pretty big. In my arterial studies. See where I want to go, 9.3. I'm sorry, guys. 1 second. Just want to make sure I get to the correct page for you. I flip through this thing so many times every day. Okay, my arterial studies are found on page 627. They're flipping way back there. 627, that's where you're going to find your arterial studies. The extremity arterial studies, that's where it begins. And again, these are easy because they're going to give you the name of the study. Like they'll say they're going to have a duplex scan of the veins, and then you'll say, okay, 93970. This part is not going to be difficult. The medicine section is not hard at all. Again, they are going to ask questions about your vaccinations for sure. You're going to have a couple vaccinations. Chemotherapy is another common one, and we'll get to that in a sec. Turn to page 602. I'm just turning back, making sure I go through this whole section. 602, page 602. Common procedures on this page. CPT code 92928. Make sure you highlight where it says percutaneous transcatheter placement, and make sure you write catheter underneath that CPT code. And then under CPT code 92933, I want you to write artery. That's an arthrectomy. These on the top of this page, put P as in Paul, T, C, A. PTCA, percutaneous transluminal coronary arthrectomy, basically. That's what 92928 and 92933 is talking about. But the two I just had you star. Last one is 92937 on 603. Those are the common procedures for this type of procedure. Do you want me to repeat them? Sure, somebody does. 92928. Under CPT code 92928, you're going to write catheter. 92933, artery. And 92937 is your vessels. Vessel. Okay, and nothing for allergies, nothing for sleep testing. They may ask though, what the name of the machine is that performs, or what the procedure is called that performs. You need to have polysomnography written down. The sleep testing. Nerve conduction studies, that's the facial nerve one. We have that starred. Nothing in genetic counseling. Hydration. Okay, so now we get into the chemo side. Hydration in chemotherapy. Do I have that? 96372. 1 second. So now I'm going to hydration. What page is that? It's in the 96s. Hydration starts on page 649, page 649. As you can see, hydration is different from chemotherapy. Chemotherapy has its own set of codes. And they're time-based codes. So when you're coding for hydration and chemo, you're basically looking in your scenario to see the length of time. How long did this procedure take? Right? So just make sure you remember that. Okay. And also there's an administration code. There is an administration code, but those are usually for like injections, or if it's provided to you intramuscular or subcutaneous, and that's CPT code 96372. That's an administration code. And it does tell you when you go to 96372, if you're administering vaccines or something like that, it tells you the administration codes, which should revert you back to like your 90460, 90461, remember, with or without counseling. And your 96372 for the administration of the injection is for anti-neoplastic, anti-neoplastic injections. Okay, so it could just be for hydration of, restoration of fluids. You would use the 96372. Well, it depends on how it's being administered. Okay, and then if they're doing hydration and they're going to administer a particular drug at the same time, you would take the drug from your HCPCS codes. And remember, your J codes are the drug codes in the HCPCS. Okay, so it tells you if it's non-chemotherapy. So they're talking about infusions right now. Infusions are considered non-chemotherapy. It could be treating, okay, or administering some type of drug, or it could be diagnostic. If more than one infusion or injection is given at the same time, remember with the vaccines, we had to do it for each. Well, with the infusions, it's telling you you only report a single initial service code. Okay, such as 96360, which is on page 650. That's for the infusions or hydration. And I think it's up to an hour, that code 96360. Or your 96372. Remember, that's if they're getting an injection. You might want to write injection next to 96372, even though it's in the description. Right? And then 96360, that's on page 650. That's IV. Right? And then it's going to be determined by the amount of time. Okay. Chemotherapy, again, is another one that's based on the amount of time. That's found on page, we're on page 652. And the two chemotherapy codes that I'm usually used to seeing, and I'm pretty sure you're going to see it also, is going to be that chemotherapy administration for the IV, and that's CPT code 96413. Make sure you highlight it's up to an hour. 96413 is up to 1 hour. And 96415 is each additional hour. Each additional hour. So if they say an hour and 20 minutes, you only can use 96413. Right? If they say an hour and 35 minutes, you still can only use 96413, right? Because 96415 is each additional hour. So it would have to be at least 2 hours to use that add-on code. So remember that. Okay. And they just said if you have to administer the name, or I'm sorry, a chemotherapy drug, remember again, it would be the J's. The J's are the drugs in your HCPCS codes. Usually they just ask about the time, the amount of time. Okay, and the intrathecal delivery, that second bullet point in the red, that's that IT, the acronym, or I'm sorry, modifier IT. That's in between the intrathecal space. And then that has to do with the nervous system. Okay, let's see. This is just FYI, other information I want to make sure I get to cover. So chemotherapy, remember, it's based on the time. Physical medicine, let's see, let's keep going. I'm on page 655. Now, physical medicine is basically it's like rehab, right? Physical rehab for like athletes or regular people. But the two usually they discuss in this particular area is going to be in reference to athletes. And so as I read through this page, there's two codes on page 655 that pertain to athletes, and that's CPT code 97005, right? That's for athletic training evaluation, or sometimes they'll come back for a re-evaluation. Okay, re-evaluation. And that would be CPT code 97006. So 97005 for the initial, 97006 for the re-evaluation. And remember those two are in reference to athletes. So I put basketball, football, because sometimes the scenario will say a football player or a basketball player. So I need to know I'm going to use these two codes. If they don't mention a sport, then you would be using 97001, which is just a physical therapy evaluation, or 97002. But more than likely, they'll have an athlete involved in there, and you'll know to use those two codes. Let's see what else we got in here for you guys. Constant attendance is on page 656. So right behind it, constant attendance. And these particular services are billed in increments of 15 minutes. So again, you would need to know the amount of time, right? Look at CPT code 97034. It says contrast baths. Sometimes they won't say contrast baths in the scenario. Sometimes they'll say hot and cold, right? So that's what contrast means, hot and cold, intermittently for 15 minutes to treat that particular area. Contrast baths, hot and cold, pay attention to the amount of time. Okay, that's called constant attendance. So someone's actually there supervising for that. Wound care management, no, they're not going to ask. I think we're almost done here. Turn to page 664. Sometimes they like to ask what is included in moderate sedation. If you look at CPT code 99143, put a star, highlight it. It tells you about the services that are included in moderate sedation. Now that's acupuncture, no chiropractic, no. Qualifying circumstances, we already know about that from anesthesia, and that moderate sedation we just saw here on page 664. And it also has bullet point here also of what's included. No home health. They won't ask about home health. And category 2 code. So that's talking about page 667. So yeah, this is the end of that chapter. So let me just make sure. So remember your category 2 codes on top of page 667. In case you didn't know, just make sure you write tracking, because these codes are used for tracking. And providers we don't pay too much attention to this section because there's no reimbursement tied to it. Okay, so these are for tracking, and they usually end with the letter F. Okay. And category, skipped over. And category 3 codes, which is also just for data collection. Remember, they look and see how many times a provider is providing a particular service, and then it's reported with this code. If there's a lot of providers throughout the year or whatever time span they put on that temporary code, if they utilize that particular service, then it grows up and becomes a new code in the front of the book with the red dot. That's how that works on those. And those codes, the category 3 codes for data collection, those end with the letter T as in Tom, and your category 3 codes begin on page 687. 687. And let me just flip through the medicine section one more time. Remember, I will be sending out the need to knows for the medicine and also for cardiovascular. The areas that I told you to read, please make sure that you do that. I wanted to just give you a few more places I want you to highlight in this medicine section. I did the crisis, page 587. Turn to page 587 in your CPT. I just like to let you know the common procedures, and I like them to kind of stand out because this is kind of like a big chapter. CPT code 90935. It's for hemodialysis procedures. Okay, and then for the access, that's to do the study, venous hemodialysis access, to determine like the blood flow. That's CPT code 90940. Make sure you highlight where it says flow study to determine blood flow. Make sure you highlight that. And we did the 591, right? Knowing the difference between intermediate and comprehensive services. Make sure you remember the whether they're new or established and how many visits, and then whether the service is intermediate or complex. Okay, so starting from page 591 through 593, again, are all those procedures for ophthalmology. Right? All the way to page 494. Even 595 is still dealing with the eyes. On page 596, you highlighted or placed a star next to CPT code 92516 for the facial nerve function studies. And they also do hearing tests in the medicine section on page 597, CPT code 92550. That's for the reflex testing. Make sure you highlight that. Speech is another common one, 92555, speech. And then the comprehensive listening threshold, 92557. Anything else, Jenny, for them? Let's see. No, you got your PTCA on page 602. You have 929 catheters, 92933 arteries, and 92937. You should have vessels. Skipping over. Echocardiography. I don't think I spoke about that. That's page 611. These are also common. CPT code 93303, transthoracic echocardiography. Make sure you highlight that, transthoracic. And it's also important that you understand it's for congenital anomalies. And then CPT code 93307, and that's also echocardiography, but it's done in real time. Make sure you have transthoracic real time. Something's in here. And make sure you highlight where it says without spectral or color. Without is the key word. Okay. On page 615, these are the, if you notice at the top, these are medicine that has to do with the cardiovascular section. I didn't mention that. So at the top, it will tell you the system it's shared with. Like this is medicine and cardiovascular. And then you have medicine and your vaccines, medicine and psychiatry. If you can see the top medicine and ophthalmology, medicine and dialysis. So it has the different headings at the top of the page. But on page 615, I want you to put a star next to CPT code 93456 and make sure you highlight where it says with right heart catheterization. I just put right on the outside of that code. 93457, make sure you highlight where it says, because this is a catheterization in bypass grafts. So make sure you highlight bypass grafts. Put a star there. CPT code 93460. Ventricular graft. Make sure you highlight that. And 93461 is a common one. It includes right and left heart catheterization. This is the place they're placing the catheter with right and left heart catheterization. So on the outside or underneath CPT code 93461, I put R and L, right? So right and left heart catheter. And again, they have a table for that, but it's not as user-friendly as the other one that we had in the 3000s. It's on page 618 and 619 is their table, but you could look and, right heart catheterization. It tells you left heart combined as right and left. You see that? But I like to just use the actual CPT codes on that. And I don't believe they go that deep in that with you guys on the exam. It's a little advanced chart. And I think we have, okay, allergen therapy, last thing, page 634. Yeah, that's the last thing I didn't go. So your page 634, where are we? Under allergen therapy, did you know that some people don't like to give their own injections, and so they'll bring their medication into the facility or into the doctor's office for them to administer it. And there are some common ones here that I want you to be familiar with, read and understand, and then highlight the key terms where you can see the differences. The first code is CPT code 95115. Right, that's an injection of allergenic extracts. And then 95145, that's the preparation. They're coming in and they're going to prepare the dose. That's for like you can see 95145, it says a single stinging insect venom. Please highlight that. And then another insect venom is a CPT code 95130. That's for like a bee sting. So I wrote bee sting there. And then the last one, 95165. Okay, 95165. That's also preparation. That is the for allergen immunotherapy. And it's for single or multiple antigens. So just make sure you highlight those keywords. So as you can see, the medicine doesn't really have a lot of detail to it. It's very straightforward. The sections where they're really going to question you is going to be on the ophthalmology, like I stated, chemotherapy, hydration, vaccinations, a couple from each of those categories. Definitely chemotherapy. And then that physical rehab, remember the difference between the athlete and the patient. And then your contrast baths, remember contrast baths are hot and cold intermittently, and they last in increments of 15 minutes. So you have to be careful to pay attention to the amount of time. And also the definition for moderate sedation, which is found on page 664. And then we just briefly touched on the codes that are ending in F and the ones that are ending in T for data collection. And with cardiovascular, we already did those little reviews. So let me open up the line. Very informative this evening.